Dorothy was on her knees in the garden, the way she'd been almost every clear morning for 30 years, pulling weeds from around the tomatoes, when she realized she couldn't get back up. Not wouldn't, couldn't, not without bracing both hands on the raised bed and pushing with her arms while her hips and shoulders screamed at her. She sat back on the grass and laughed about it. Actually laughed, because she'd already decided months earlier what this was: arthritis, getting older. The cold mornings, she'd started saying, "It's just my arthritis acting up," so often that her daughter could finish the sentence for her. There was one other thing, though, that Dorothy had mentioned only once, almost as a joke, over dinner a few weeks before. She'd said her jaw got tired when she chewed anything remotely tough, like she'd been gnawing on something for an hour, and she'd laughed that one off too. "Too much steak, not enough teeth," she'd said. Nobody at that table, including Dorothy, had any reason to think a tired jaw had anything whatsoever to do with sore shoulders. It did. And by the end of tonight, you're going to understand exactly why, because the connection between those two things is one of the 6 signs I want to walk you through, and it is, without exaggeration, one of the more urgent things I can teach you on this channel. I'm Dr. Walter Hale, nearly 4 decades of practicing medicine, and I want to be honest with you about something before we go any further. Most joint pain after 60 really is exactly what everyone assumes it is: ordinary wear and tear, cartilage that's thinned out after decades of use, osteoarthritis, the kind of ache that responds to a warm shower, some ibuprofen, and a little patience. I am not here tonight to make you afraid of every twinge in your knee. If I did that, I'd be doing you a disservice, and honestly, I'd be no different from a dozen other channels that specialize in turning normal aging into a 5-alarm fire for clicks. But there is a specific, real, well-documented set of 6 signs that doctors are trained to watch for, specifically because they mean the pain in front of us might not be that ordinary story. A few of these, if missed, don't just mean more discomfort. One of them, specifically, can cost a person permanent vision in one or both eyes, with almost no warning beyond exactly the kind of details Dorothy mentioned at that dinner table. So tonight isn't about scaring you away from gardening. It's about making sure you know the difference between the ache that just needs patience and the ache that needs a phone call this week, not eventually. Before we get into the 6, tell me something in the comments, honestly. Where is your joint pain worst right now, if you have any? Knees, hips, hands, shoulders? Keep that in mind as we go, because by the end of this list, I think a few of you are going to recognize your own pattern in a way you didn't expect to tonight. Let me give you the baseline first, quickly, because you can't spot the exception if you don't know the rule. Ordinary osteoarthritis tends to follow a fairly predictable shape. It usually shows up in the joints that have carried the most weight or done the most repetitive work over a lifetime: knees, hips, the base of the thumb, the last knuckle of the fingers. It's often worse on one side than the other, especially if that side has an old injury behind it. It gets worse with activity and better with rest, and the stiffness you feel first thing in the morning, while real and sometimes genuinely uncomfortable, typically loosens up within 20 to 30 minutes of moving around. That's the shape of ordinary wear and tear. Mechanically, what's actually happening is fairly straightforward. The cartilage that cushions the ends of your bones thins out gradually over decades of use, and eventually you can end up with bone essentially grinding against bone in the worst affected spots, which is exactly what shows up as narrowed joint space on an X-ray. It's the most common reason older joints hurt, by a wide margin, and for most people, most of the time it's manageable with activity modification, physical therapy, weight management, and over-the-counter pain relief. Everything on tonight's list breaks that ordinary shape in a specific, recognizable way. Let's start with number 6. Number 6. Morning stiffness that drags on well past an hour. I want you to actually pay attention to this one honestly, because most people don't clock it accurately. They know they're stiff in the morning, and they assume that's just what stiff feels like. But there's a real meaningful difference between stiffness that eases within half an hour of getting up and moving, which is typical of ordinary wear and tear, and stiffness that keeps your hands feeling swollen and locked for an hour, 90 minutes, sometimes most of the morning, before it finally loosens. That second pattern is one of the specific features rheumatologists are taught to ask about directly, because prolonged morning stiffness, particularly in the small joints of the hands and wrists, is a genuine hallmark of inflammatory arthritis. Conditions like rheumatoid arthritis, where the joint lining itself is inflamed overnight rather than simply worn down. The fix here isn't complicated, but it does require honesty with yourself. For 1 week, actually time it. Not "it's stiff for a while." An actual number of minutes written down from the moment you wake up to the moment your hands or knees genuinely feel loose. If that number is consistently over an hour, that's worth mentioning to your doctor specifically, using that number, rather than the vague phrase, "I'm stiff in the mornings," which honestly doesn't tell a physician very much on its own. Number 5, pain that shows up symmetrically, both sides of your body, roughly evenly, at the same time. Ordinary wear and tear tends to be lopsided. You favored one knee for years after an old injury, so that's the one that wears out first. You're right-handed, so the base of your right thumb complains before the left one does. It makes mechanical sense. But when both hands, both wrists, or both feet start hurting at roughly the same time, roughly the same severity, roughly the same joints on each side, that symmetry is actually a meaningful clue. It suggests something systemic is happening, your immune system treating both sides of your body the same way, rather than years of uneven use catching up with you unevenly. This pattern, combined with the prolonged morning stiffness from number 6, is specifically why rheumatoid arthritis can look so different from osteoarthritis once you know what you're looking at. It's not just arthritis, but worse. It's a different process entirely, driven by the immune system attacking the lining of the joint, and it responds to entirely different treatments than simple wear and tear does. If you've noticed both hands aching at once, in the same pattern, don't file it away as arthritis is arthritis. Ask your doctor directly whether blood work for inflammatory markers makes sense. It's a simple blood draw, and it can meaningfully change what happens next. One honest caveat worth knowing before that appointment, because it can save you some confusion. The most commonly ordered test, rheumatoid factor, isn't perfectly clean. A meaningful number of healthy older adults, particularly in their 70s and beyond, can show a mildly positive rheumatoid factor without having rheumatoid arthritis at all, simply as a quirk of an aging immune system. That's exactly why doctors usually pair it with a second, more specific test called anti-CCP, or anti-cyclic citrullinated peptide antibodies, which is far less likely to show a false alarm. If your rheumatoid factor comes back positive, but your doctor doesn't seem alarmed, that nuance is very likely why, and it's worth asking about the anti-CCP results specifically, rather than fixating on the first number alone. Number 4. A joint that goes from completely fine to furious overnight. This is one I want you to take seriously the same day it happens, not the same week. I'm talking about a joint, often the big toe, the ankle, or the knee, that was unremarkable yesterday and today is hot to the touch, visibly swollen, red, and so tender that even a bedsheet resting on it feels unbearable. There are 2 real explanations for this pattern, and both of them deserve prompt attention rather than a wait-and-see approach. The first is gout, a genuinely common condition where uric acid crystals build up and deposit sharply into a joint, most classically the big toe, causing sudden, severe inflammation. It's treatable and manageable once identified, but it tends to recur if the underlying uric acid levels aren't addressed. The second possibility is more urgent, and it's the reason I don't want anyone assuming it's probably just a gout flare without getting it checked, especially if there's any fever involved. Septic arthritis is an actual infection inside the joint itself, and it is a genuine medical emergency. Left untreated, the infection can destroy the joint's cartilage within days, sometimes permanently, and can make someone quite seriously ill beyond the joint itself. There's actually a third possibility worth knowing by name, because it's more common in older adults specifically than most people realize: pseudogout, caused by a different kind of crystal, calcium pyrophosphate, depositing in a joint, most often the knee or wrist. It looks and feels remarkably similar to gout from the outside: sudden, hot, swollen, and it's genuinely more common after 60 than true gout is in some populations, but it's identified and managed somewhat differently. The only way to reliably tell all three of these apart, gout, pseudogout, and septic arthritis, is for a doctor to examine the joint and often draw a small sample of the joint fluid itself for analysis under a microscope. A hot, red, sudden, severely painful joint, especially with any fever, is not a wait until Monday situation. It's a same-day or urgent care situation. We're at the halfway mark, 3 signs down and 3 still to go, and honestly, the second half is where I most need you paying attention. If this is worth anything to you so far, hit subscribe now so this channel doesn't slip past you before the next one, because I'd rather you hear this than lose track of it in a crowded feed. And tell me honestly in the comments, has a doctor ever actually used the word symmetric when describing your joints to you, or is tonight the first time that word's come up at all? Number 3, pain that's present at rest, or pain that actually wakes you up at night. Mechanical wear and tear has a fairly reliable relationship with use. It gets worse as you move and improves, at least somewhat, when you sit or lie down and take the weight off. So when pain is present even sitting perfectly still, or when it's severe enough to actually wake you from sleep, that's a meaningful departure from the ordinary pattern, and it's worth paying attention to rather than assuming it's simply worse wear and tear. There are a few real explanations doctors consider here. It can point toward inflammatory processes, similar to what we discussed with symmetry and morning stiffness. In people with known osteoporosis, and I've talked about osteoporosis at length on this channel before, deep, resting pain in a joint or bone can occasionally be an early sign of a stress fracture that hasn't fully declared itself yet, one that hasn't shown up clearly on a first look. And in rare cases, persistent pain that doesn't follow the usual use and rest pattern warrants imaging simply to rule out something growing where it shouldn't be. I want to be careful here not to send anyone spiraling. The overwhelming majority of night pain in older joints is still explainable by common, manageable causes, but pain that wakes me from sleep is a specific detail worth using those exact words with your doctor, because it changes what gets considered. Number 2, and this is Dorothy's story, and I want to walk through it slowly because it's the one I most need you to actually remember. New aching and stiffness specifically centered in the shoulders and hips, the large muscle groups sometimes called the shoulder and hip girdles, especially if it came on within days to a couple of weeks, rather than building gradually over months in someone over 50. On its own, that pattern already has a name, polymyalgia rheumatica, often shortened to PMR, a real and reasonably common inflammatory condition that causes exactly this kind of aching stiffness, often severe enough to make it hard to lift your arms overhead or get up from a low chair without help. Here's why I need you to know the name specifically and not just file it under more stiffness. Somewhere between roughly 1 in 6 and 1 in 5 people with polymyalgia rheumatica also have or go on to develop a more dangerous companion condition called giant cell arteritis, sometimes called temporal arteritis. This is inflammation in the arteries that supply blood to the scalp, the jaw muscles, and critically the eyes. And the warning signs of giant cell arteritis are specific enough that once you know them, you'll never dismiss them again. A new headache, often on one side of the scalp, tenderness when you brush your hair or rest your head on a pillow, and exactly like Dorothy mentioned almost as a joke, jaw pain or fatigue specifically when chewing, something doctors call jaw claudication, because the jaw muscles are essentially running out of blood supply the same way a leg cramps when it's not getting enough circulation during exertion. If giant cell arteritis goes untreated, the inflamed artery supplying the eye can become blocked, and the result can be sudden, permanent, irreversible blindness in that eye, sometimes with almost no warning beyond the headache, scalp tenderness, and jaw fatigue that came before it. This is one of the true rheumatologic emergencies, one of the very few situations where a doctor will start high-dose steroid treatment immediately, the same day, based on symptoms and blood work alone, before waiting for a confirming biopsy, because the risk of waiting for perfect certainty is measured in permanent eyesight. Dorothy's doctor caught it because of that offhand comment about her jaw. He asked one more question, whether she'd noticed any new headaches, and she had, though she'd blamed it on not drinking enough water. He ran blood work that same afternoon, specifically a test called the sedimentation rate, along with C-reactive protein, both markers of inflammation that tend to run dramatically high in giant cell arteritis. Both came back elevated. She started steroids that day, was referred for a temporal artery biopsy to confirm the diagnosis, and her vision, both eyes, is completely intact today. She's a composite of a number of patients I've cared for with this exact pattern rather than one single identifiable person, so there's no privacy concern in sharing her story. But the details, right down to the tired jaw at dinner, are drawn from real cases I think about often, specifically because the warning was so easy to miss and so easy to catch, in the same conversation, depending entirely on whether anyone thought to ask. If you are over 50 and you've developed new, fairly sudden shoulder or hip stiffness, and especially if you can add any of the following to that list, a new headache, tenderness on your scalp, or jaw tiredness with chewing, please don't wait. Call your doctor this week and describe it using those specific words. This is not a symptom pattern where let's see if it gets better on its own is the safe choice. Number 1. Joint pain accompanied by symptoms that seemingly have nothing to do with your joints at all. Unexplained weight loss you didn't try for, drenching night sweats that soak through your clothes, fevers that come and go without an obvious infection, or a swollen lump somewhere, a lymph node in your neck, armpit, or groin that wasn't there before. I want to be very careful with this one because I don't want a single person watching to leave here thinking joint pain means cancer. It overwhelmingly does not. And the vast majority of people with joint pain and even the occasional unrelated symptom have nothing systemic going on at all. But there is a real pattern doctors are trained never to wave away, where joint pain is one of the very first noticeable symptoms of something happening elsewhere in the body. Certain infections, certain autoimmune conditions, and in rare cases, certain blood-related cancers can all present initially as joint aching before anything else becomes obvious. The signal isn't the joint pain by itself. It's joint pain paired with those systemic symptoms, weight loss you didn't work for, night sweats, unexplained fevers, or a new lump. If you have joint pain and any of those together, don't let your doctor's visit become two separate, unrelated complaints. Say them in the same sentence. That combination is what changes how a physician thinks about the case. Here's the actual thread running underneath all 6 of these, because I don't want you to walk away from this video simply cataloging 6 scary possibilities. Ordinary wear and tear follows a fairly predictable shape. It favors the joints you've used hardest. It improves with rest, morning stiffness resolves reasonably quickly, and it doesn't come with fevers, weight loss, or night sweats. Every single sign on tonight's list is in its own way a break from that predictable shape. Symmetry instead of lopsidedness, stiffness that won't quit instead of stiffness that loosens, pain at rest instead of pain with use, a joint that erupts overnight instead of one that wears down over years. Systemic symptoms riding alongside the joint pain instead of the joint pain standing alone, and a very specific companion pattern, shoulder and hip stiffness with jaw fatigue and scalp tenderness that has an actual name and an actual urgency attached to it. If your joint pain fits the ordinary shape, I am genuinely not trying to send you to urgent care over a stiff knee on a cold morning. But if it breaks that shape in one of these 6 specific ways, that's the difference between a conversation you can have at your next routine visit and one that's worth making a phone call about today. If you only take 4 things from tonight, make them these. First, for 1 week, time your morning stiffness honestly, in actual minutes, and write the number down. If it's consistently over an hour, bring that specific number to your doctor. Second, pay attention to whether your pain is symmetric, roughly the same joints on both sides at roughly the same time, versus lopsided and tied to old injuries or dominant hand wear. That distinction alone helps a doctor narrow down what's actually happening. Third, if you're over 50 and you develop new shoulder or hip stiffness, especially combined with any new headache, scalp tenderness, or jaw fatigue while chewing, call this week. Use those exact words. Don't wait to see if it passes. Fourth, if joint pain shows up alongside unexplained weight loss, night sweats, fevers, or a new lump anywhere, say all of it together in the same appointment, not as separate, unrelated complaints. Of the 6 signs tonight, which one hit closest to home, either for you or for someone you love? Tell me honestly in the comments, and if any of you have a Dorothy moment of your own, a small detail you almost didn't mention that turned out to matter, I would genuinely like to hear it, because I think it helps everyone else watching take their own small, easy-to-dismiss details a little more seriously. There's a video coming next that I think a lot of you have quietly wondered about without ever finding a straight answer, so subscribe now if you don't want to miss it. The real, specific reason your weight won't come off after 60, even when you're eating carefully and moving the way you always have. This isn't a diagnosis for your specific joints, and it isn't a reason to panic over every ordinary ache. If tonight's 6 patterns genuinely sound familiar, treat that as your reason to get examined this week rather than to guess from a video. I'm Dr. Walter Hale. Most joint pain really is exactly what it looks like. It's the pain that quietly breaks its own rules that deserves your full attention, and now you know exactly what those rules are.